On December 1st, Wisconsin's Department of Health Services issued a memo on behalf of State Medicaid Director Jim Jones, affirming Wisconsin's commitment to addressing racial injustice and inequity for Wisconsin's children. The memo recognizes that racial injustice and inequities have become the central topic in national dialogue in 2020, with an increased awareness of systemic racism as COVID disproportionately impacted people of color. More cases, more hospitalizations, and more deaths. The informational memo had multiple purposes laid out. First was to raise awareness of the systemic racism in Wisconsin's healthcare systems. The memo says it wants to focus attention on the public health crisis that result from racism and initiate planning for the steps necessary to address the racism in programs administered through Medicaid. And they're going to start with the Children's Long-Term Support Programs and the Birth to 3 program. The state Medicaid director, Jim Jones, writes, the pandemic's disproportionate impact underscores what we already knew. Racial injustice and inequity negatively impacts health. And he points to Wisconsin's terrible statistics and birth outcomes, especially for Black babies. He continues, as a national leader in many long-term care programs and among the most successful state in supporting individuals with disabilities, Wisconsin must take action to reverse our course in these areas where we are falling unacceptably short. Now, he offers action steps. The Bureau of Children's Services is planning to focus 2021 on using training and data analysis to promote increased knowledge and understanding to drive improvements. Another action step will be to engage program councils to explore policy efforts that can contribute to improving outcomes for Black children in the state Medicaid programs. Finally, seeking your input. They say, please share your suggestions or ideas to help propel Wisconsin forward. You can read the memo shared by the Department of Health Services and Medicaid Director Jim Jones. You can contact the Division of Medicaid Services to provide your input that they're calling for. You can also contact our Regional Center for Children and Youth with Special Healthcare Needs and talk to them about services that may be offered for you and your children, or share some of your feedback on how these programs can be improved.